Good afternoon. I hope you can all see me and we are live. I'm assuming that we are live already. I hope you're all having a good time and enjoying the sunny holidays. Um, for those of you who don't know me, my name is Rishi Singhal. I'm not seeing any feeds coming along, so if you start having any questions, just start asking them as the topic is going along. So my name is Rishi Singhal. I'm a consultant bariatric surgeon. I'm also the medical director for Healthy Weight. So, to give you a bit of a brief about me, I work out of Birmingham. I've been the medical director for Healthy Weight for the last 5 years. And I also work in the NHS. I work at the Birmingham Heartlands Hospital, where I'm one of the bariatric surgeons there. My repertoire of bariatric surgery extends to almost all of the operations in bariatric surgery, which include the gastric band, the gastric sleeve, the gastric bypass, the mini gastric bypass. But my main interests and passions lie in doing revisional bariatric surgery and expanding endoscopic bariatric surgery. So let's try understanding what these operations are. What is revisional surgery and what is endoscopic bariatric surgery? Revisional surgery is kind of a bariatric operation which you do when you've had a complication with a bariatric operation in the past. Can you hear me? I'm not getting an indication of whether you can hear me. Let me check with my team whether you can hear me now. Just give me a moment. I'll be back with you momentarily. Just checking whether you can hear me. I think the feed is live. I'm just checking whether you can hear me and then I'll go along. Okay, so I understand you can now hear me. So let's discuss. I've had a question come in actually. So let's go back to revisional surgery in a bit. I've had a question come in about a mini gastric bypass. So what's a mini gastric bypass? Well, in a mini gastric bypass, it's type of a bypass, but you divide the stomach and make the stomach pouch a bit longer. And instead of dividing the bowel, you join the bowel to the stomach directly. So it's a loop of the bowel rather than a cut piece of the bowel that is joined to the stomach. What is the advantage of this operation? The advantage of this operation is that we believe the weight loss is better than a standard Roux-en-Y gastric bypass. But more importantly, the risk of subsequent problems such as internal hernias is lower. Now, one of the issues with the mini gastric bypass is that it is a much more powerful operation as compared to the gastric bypass. So we have to be much more careful with nutritional deficiencies. We have to make sure that we take our vitamins, we have to take our injections for B12. And at the same time, you have to maintain a very good high protein diet. Otherwise, people can develop protein deficiency after a mini gastric bypass. But what is important is for you to discuss with your surgeon what operation you want. At Healthy Weight, we would offer you all kinds of operations in bariatric surgery, including the band, the sleeve, the bypass, and the mini bypass. And it is very important to have a discussion with your surgeon, which is the best operation for you. So now going back onto revisional surgery. Oh, well, again, we've had another question from Marie. What are the risks involved with the procedures? Risks of the procedure depend on two main variables, or I would say three main variables: patient factors, operation or surgeon factors, and hospital factors. So if you look at patient factors, what is important is what are the medical problems the patient has, such as does the patient have hypertension, does the patient have diabetes, does the patient have heart disease, does the patient have sleep apnea, or does the patient have any other medical problems that could affect their outcomes. So of course, the more medical problems you have, the higher the risks. With regards to the operation, I think all operations have a very, very low morbidity, which means the risk of complications after any operation is very low. But what is important to know is that even though the risk is low, whether your consultant, your surgeon, and the company that you're going with is capable of handling such complications. The third factor that is important is the kind of hospital you're working in. If you're working in a big hospital, which has a high dependency unit, an intensive care unit, we can operate on patients who have much more health problems and still provide very good and safe outcomes for these patients. Okay, so we've had a question from Fabulous Nails. What better if you would like to transition from band to sleeve or band to bypass? And what's the rough cost? Okay. Um, when you've had a previous band, and the bands can fail for a variety of reasons. I mean, band is a good operation, and we have lots of patients who have had successful bands. But with any operation, there's the risk of failure or complications. When you remove a gastric band, there's an area of scarring left on top of the stomach. And scar tissue, as we know, is always weaker. And that plays an important part in deciding which operation we do. In the past, many surgeons have attempted band to sleeves as well. But I believe, and I've done a lot of research on this subject of revisional surgery, of band to sleeve versus band to bypass surgery, the risks in band to sleeve are much higher than a band to bypass operation. As a result, we generally advocate doing band to bypass because, firstly, the weight loss is better, the risk of complications is lower, and thirdly, even if there are complications, they are easier to manage as compared to a band to sleeve operation. So the short answer is that a band to bypass operation is better than a band to sleeve operation. Okay, we have more questions coming up about revisional surgery. Does everybody need revisional surgery? Well, it's about what you want. If you're not happy with the outcomes of your operation, you have worked with your operation a lot, and sometimes I sometimes stop talking because I see messages that are coming up. So whenever there are messages coming up, I have to look down and try answering them. Um, Sometimes patients have had bariatric surgery and they've not been supported throughout their journey, and as a result, their outcomes are poor. If you think you are not happy with your outcomes of bariatric surgery, you think you didn't were not provided with enough support, and as a result your outcomes have been poor, I think it is important for you to arrange an appointment with us, to have a sit down with the surgeon or a web chat with the surgeon these days, to discuss what the options are. Maybe we can support you in some other ways. Maybe we can teach you how to eat better, or maybe we need to do a revisional operation. Not everybody needs an operation, but you have to come to us to discuss with us, and then we can decide what we need to do. We have a question from Mike. I've had a phone consultation. What's the next stage? Well, the next stage usually is that we contact you. So once you've had a consultation with a surgeon, the surgeon would usually do the notes. The notes would then go to our team. The team processes them, and the team would then contact you. So hang fire, Mike. Somebody will contact you about it. So another question we've got from Heidi. How much is the surgery and the anticipated recovery time? Well, surgery packages are constructed according to what medical problems you have. Do you require high dependence unit? Do you require intensive care unit? So I think you need to talk to one of the members in our team to discuss what kind of a package you will need. But anticipated recovery time, well, Heidi, anticipate recovery after bariatric surgery is very good. Firstly, because it is a laparoscopic procedure, so we don't make any big cuts, we make tiny keyholes. You're home on the same day of a band or within a couple of days after a sleeve or a bypass or even a revisional operation. Most patients are walking the same day after surgery or the next day after surgery, but within 7 to 10 days, I know that most patients are back to work. Now, this is not 100% for everybody. Now, this is not 100% for everybody. Some patients may go home early and have difficulty in mobilizing after that. Others may go home later and may have a very good recovery after that. So not all patients will start going to work at 7 days or 10 days. Some will take 2 weeks, others may take 7 days or less. So it is dependent on the patient, but 7 to 10 days is an average, I would say. Okay, lots of people asking when the surgery will start again. Okay, a lot of people are asking this question, when the surgery will start again. It's a $1 million question. It's a difficult question to answer, but let me try simplifying this answer for you. we are hopeful that hospitals will start working on the 1st of July. So, what is happening currently is the NHS is under tremendous stress. A lot of the elective operations were cancelled in the NHS. And these operations and many of the cancer operations had to be moved to the private sector. As a result, the private hospitals are now inundated with a lot of operations from the NHS. Now, the private hospitals have already indicated to us that from the 1st of July, NHS services are being repatriated, so they will start doing private surgery. Now, it is going to be different regions and it's going to be different for different hospitals. Some hospitals may start in the beginning of July, others may start in the mid of July. What I can tell you for a fact is that we cannot give you a date right now. If somebody is promising you dates, I don't think we can really promise anybody any dates because no hospitals in UK have indicated when we can start surgery. We've also had this discussion in BOMS. BOMS is the British Obesity Society. And the president of BOMS has also indicated yesterday that we can start surgery from the 1st of July. So I think surgery would be starting in a staggered fashion in July at some point. Of course, we will have to make this decision on a week by week basis. What is important for you to do is stay in touch with our team, keep going to our website, keep talking to our team, and we'll keep you informed about when the hospital that you are booked in, when it is starting. It may be in the beginning of July, it may be in the mid of July, but we'll keep you informed. So most important thing is that you maintain contact with us. Okay, so I have another question that is coming up. I'm on Cosentix in. Am I live again? Let me check what's happening. Okay, so we are live again. I'm so sorry. I have no idea why my internet got disconnected. So we still have a lot of questions coming in. And the question that I was trying to answer was about biosimilars or biological drugs. Biological drugs are used for problems such as rheumatoid arthritis, psoriatic arthritis, and problems such as arthritis or Crohn's disease. These drugs should be stopped for at least 2 weeks prior to the operation and 2 weeks after the operation. This is because these drugs reduce healing and they can increase the risk of complications. In most cases, whenever you see your surgeon at Healthier Weight, we will liaise with your clinician and make sure that these drugs are stopped in a safe way. And if you need any other drugs with them, we will do that at the same time and start them. Okay? So we have some more questions coming up. I have a question coming up from Maxine. My question is esophageal dysmotility. What is the best way to treat it? Okay. Esophageal dysmotility can happen. It's a difficult condition to sometimes diagnose. It can happen in patients who've had a gastric band, and sometimes in patients who've had even a gastric sleeve. It can happen in patients with gastric bands or patients with gastric sleeves. The best treatment for esophageal dysmotility is for you to see a surgeon. Sometimes you may need a barium swallow to have a look as to how bad the esophageal dysmotility is. If you've had a gastric band, we will need to deflate the gastric band to make sure that your esophagus recovers. If you've had a sleeve, it is possible that you have a tightening or a stricture of your sleeve. If that is the problem, then we may need to stretch your sleeve sometimes. But this is a complicated condition to treat. So I think it is important for you to visit your doctor or visit somebody at Healthier Weight, talk to one of our surgeons, and we can discuss with you what to do next. Okay. We have some more questions coming up. Nick Johnson. I'm struggling to remember to take my multivitamins every day. How important are they? And what happens in the short to medium term? Nick, I don't think we should even discuss what happens if you don't take your vitamins, because I don't think there's a way around it. We have a contract that I will do your operation, but you have to take vitamins regularly. If you don't take vitamins, a lot of problems can start happening. You can start having problem with your memory, start having problem with your hair, with your skin. You'll start getting a bit more wrinkles. You'll start having problems with your nails, and then the severe problems start having. You start having problems with your nerves. You'll stop feeling things. You can't feel hot or cold sometimes. You'll start having problems with your respiration. So I don't think we should even discuss this. I think it is very, very important for you to understand that you have to continue taking your vitamins no matter what. Question for Victoria. I'm over 20 stone with fibromyalgia. Would I be a good candidate for bariatric surgery? Of course, Victoria. Uh, Fibromyalgia is a new condition. In the last 10 years, we have started knowing much more about fibromyalgia, but we know that weight can affect fibromyalgia. The fact that you're 20 stone doesn't worry us because we are specialists in treating patients who are overweight. So, if you're worried about your weight, you have fibromyalgia, come and have a chat with us. We will discuss with you what operation is best for you, how we treat it, how we manage your medications for my fibromyalgia. And I've noticed in a lot of my patients in the past that their fibromyalgia has actually improved after having bariatric surgery. So I would not be hesitant about offering you bariatric surgery at all. I think it's a very good indication. I think you should go ahead and have surgery. Okay, question from Melanie. My BMI is 51 with no comorbidity, and I'm a 47-year-old. I need to lose 11 stone, but still want a reasonable quality of life. I have had my gastric band removed last year and had previously lost 8 stone in the 15 years that I had it working. Well, Melanie, I'm very sorry to hear that your gastric band was removed last year, but I'm very pleased to see that you did very well with the band. In 15 years, you lost 8 stone, so that shows me that you are somebody who's committed. You are somebody who's ready to engage with an operation and try doing best with that operation. I think what is important is that you need to come and discuss with the surgeon what is the right operation for you. The options include a band to bypass conversion or a band to sleeve conversion. As I've spoken in the earlier part of this webinar, that band to bypass is the better operation. That is because the weight loss is better, the risk of complications is lower, but more importantly, if there are any complications with the gastric bypass, they can be handled very easily. So important thing is for you to come and have a chat with us, and then we can discuss what operation we can do for you. Question from Emma. Is collagen a good supplement to take prior to surgery and afterwards? Emma, you can take collagen. It is not something that we necessarily recommend. There is no evidence to say that it works or it is better than anything else. But if you would like to take that supplement, I won't stop you from taking it. Of course, for the first 6 weeks after surgery, you cannot have any big tablets or tablets sometimes. So you will have to discuss with your nurse or discuss with your surgeon when can you restart your tablets again. But before the operation, of course, you can. Usually after the operation for the first 6 weeks, we give you dissolvable or chewable tablets so that they don't get stuck into your stomach. Okay, we have some more questions coming up. Question from Linda. I am 63 and 23 stone. Am I too old for surgery or too big? Linda, thank you very much for this question. Firstly, we are specialists in obesity surgery. So we are quite capable of handling any patient who comes to us. To just give you an example, at Healthier Weight, we have done operations on patients as heavy as 40 stone. So I would say that 23 stone is not big at all. 63 is not a problem. We operate till the age of 70 at Healthier Weight. It depends on what medical problems you have. So it is important for you to come and actually discuss with your surgeon about the medical problems you have. But I have no doubt that we will find a way to safely do your operation, whichever operation you are interested in and what is suited for you. Question from Emma. Is biotin good for hair? Emma, biotin is good for hair. You can take it preoperatively if you want. You can start taking it postoperatively 6 weeks after the operation. But the supplements we advise you do have biotin in them already. So you don't have to take extra biotin. But if you do want to take extra biotin, that's fine with us. You can start taking it 6 weeks after your operation. Okay. More questions coming in. We have a question from Rachel. How do you know which procedure is right for you? How long is the consultation period before surgery? Is anyone ever turned down? Okay, so Rachel, which procedure is right for you? Rachel, that depends on a lot of things. What is your age? What is your weight? What medical problems do you have? Do you have diabetes? Do you have hypertension? Do you have raised cholesterol? Do you have sleep apnea? And there is no one right answer. That is why you have to sit down with a surgeon and discuss these things. As a rule of thumb, I would say that if you have diabetes and if you're on a lot of medications for diabetes, usually a bypass is preferred, but that is not definite. In somebody who has a body mass index of more than 50, we usually advise a sleeve or a bypass. But then again, that is why if you have a BMI of 35 with no medical problems, we may advise you to have a gastric band. But on the other hand, if you are 35 BMI with diabetes and taking insulin, I may advise you to have a bypass instead. So these are complex decisions. What is important is for you to go to your surgeon, have a discussion with your surgeon, what operation you can have and why. How long is the consultation period before the surgery? Well, you will talk with one of our experienced patient care coordinators first, and they will spend as much time as is required with you to help you make the decision. Our patient care coordinators are very well trained. They know all you have to know about most of the operations. They will give you all the information you need. Once you are happy and you have started making a decision, then they will arrange an appointment for you to see one of our surgeons. Now, the surgical consultation can be as long or as short as you want it to be. We try that each consultation is at least 30 minutes, but if you need more time, we will give you more time. These are important decisions, these are lifestyle changing decisions, these are lifelong decisions. So, these can't be taken easily. If you need to see your surgeon again, if you want to talk to your surgeon again, I think that's reasonable and we can arrange that for you as well. So it depends on as much time as you need. Is anyone ever turned down? It depends on the reasons for turning you down. If you have a lot of medical problems, um, then we may have to tailor the approach. Then you may have to come to one of our specialist centers. So if you're taking medicines for many things and you have sleep apnea and you wear a mask as well, then we may decide to go to one of our specialist centers, such as the center in Manchester, or the center in Birmingham, or the center in London, or the center in Leeds, where we can do operations on patients with complex needs. Usually, we can find a way to make things work for you. So, yes, it is possible that we turn patients down, but it is highly unlikely. I think what is important is for you to go and meet your surgeon, sit down with them, and discuss as to what is required. Okay, we have some more questions coming in. Question from Sarah. I want to have sleeve surgery. However, in terms of COVID 19, what should I do? Sarah, you don't have to worry about a thing. We are, as we speak, drafting protocols for COVID 19. What will probably be required in the early phases for all patients to self quarantine for 2 weeks prior to the operation. This is important so that we can make sure that when you come into hospital to have surgery, you don't have any COVID. At the same time, we will be doing a preoperative test for you to make absolutely certain that you don't have the disease. Once you're admitted to hospital, everybody who's coming into contact with you will be taking precautions. And in theater, again, we will be using full PPE. So we will be using masks and all that kind of equipment to prevent transmission of infection to you. Once you go home, again, we will advise you to stay away from everybody else for a week or so till you gain enough strength. Once you have recuperated from your operation in a couple of weeks, you are like anybody else, and I don't think the risks to you are any more. So I think it's a very important question what to do when it is COVID. But don't worry, we will look after you. We will take you through each and every process. Question from Libby. I'm interested to understand better about the long-term lifestyle changes associated with the sleeve surgery and also about the hormone changes. Okay, Libby, that's a very, very good question. All of these operations are lifestyle changing operations. The operations don't work on their own. The operations work because you engage with the operations. The role of the operation is to change the way you think about food, the way you feel about food, and the way you eat food. But you have to work with the operation to maintain these changes. So engagement is very important, and it is a lifestyle engagement. And it is a lifelong engagement. You have to engage for the rest of your life with your operation so that the operation keeps on working the way it is supposed to. Now, your second question was what about the hormone changes? Well, in a sleeve gastrectomy, the home we take away 80% of the stomach. As a result, that removes the hormone ghrelin. Ghrelin is the hormone that makes you hungry and makes you eat. So once the levels of ghrelin are reduced, your appetite goes down, and as a result, you lose the weight. In a bypass, there are other hormones such as GLP-1, PYY, GIP. These hormones change the way you think about food, change the way you smell food, change the way you taste food. And that is what brings about the long changes after a bariatric operation. We have another question coming from Tammy. How long after can I go on a flight? Tammy, that's a very good question, especially because people are traveling a lot, or they used to travel a lot before COVID. I don't think patients will be traveling a lot now. However, I advise at least a couple of weeks. Although the official rules are 5 days, I usually say at least a couple of weeks before you can take a flight after an operation. Right, question from Janice. I would like to lose 3.5 stone. I'm 5 foot 6 inch and weigh 14 stone 2 pounds and 58 years old. Do you think a gastric band would be suitable? I think, Janice, you will be suitable for all operations. As I said earlier in this webinar today, that the choice of an operation is a dynamic discussion between you and the surgeon. And we need to understand what you want, what medical problems you have, and what is the best operation for your particular kind of lifestyle. So yes, I think a gastric band is suitable for you, but you may like the sound of other operations too. So it is very important to actually sit down with a surgeon to discuss with him what is actually best for you so that we can advise you on the best course of events. Okay. Sarah Ali, how much is a gastric sleeve? Sarah, we have your details. The cost of an operation depends on a lot of things, what medical problems you have, what kind of a stay you will require, whether you need HDU, whether you require ITU. So we have your question now. We will send you a code. Don't worry about that, Sarah. Okay, a question from M. How long will it be before we can sleep on our sides? Very interesting question, M. I haven't heard this question before. I think when you feel comfortable, by rolling in bed, you are not going to disrupt your operation. So if the same night after the operation you want to sleep on your side, I'll say that's fine. As long as you're feeling comfortable, it's not a problem. My operation will not be affected by you sleeping on your side or sleeping on your tummy. Okay. We have only 10 minutes left, so keep your questions coming. We have a question from Rachel. In terms of COVID-19 and traveling by plane for surgery, how would the 2 week self quarantine work? Very tricky question, Rachel. I think if you're traveling by plane, you will have to come to the UK 2 weeks prior to surgery. You will need to self quarantine with your family or without your family for 2 weeks in UK, because I don't think if you're traveling on a plane, unless you're coming by private jet, that you will be considered self quarantined. And again, for a week after surgery, you will have to relatively quarantine yourself. I would be quite happy for you to travel back 2 weeks after the operation, but I suspect you will have to come at least 2 weeks prior to the operation for quarantine. Okay, we have some more questions coming in. Question from Elizabeth. Does sleeve gastrectomy involve invasive surgery? Well, Elizabeth, that's a very good question. All operations are invasive. So whenever we do an operation, although it is keyhole and we are going in through very little cuts in your tummy, they are invasive. So the short answer is yes, all operations are invasive, and sleeve gastrectomy is an invasive operation as well. Question from Fifi. What procedure, if any, would recommend for a 24-year-old female that is 115 kg and has been struggling with weight all her life? I've been advised differently by different surgeons between the balloon and the sleeve. Fifi, good question again. I think it is important for you to come and have a chat with us. As I said, no one size fits all. We will need to see what your requirements are, what your circumstances are, and what do you expect from life. At the same time, we need to see what medical problems you have, and only then we will be able to advise you what is the right operation for you. Now, we have another question coming in. Can we get loose, baggy skin removed from tummy on the NHS? I think that's tricky. In the next foreseeable future, for the next 1 to 1.5 year, I don't think the NHS will be doing any plastic operations, but I cannot answer on behalf of the NHS. You can definitely get an abdominoplasty in the private sector, but I don't think in the next 6 months to 1 year you'll be getting one on the NHS at all. Once the services resume normally, then maybe. Question from M. Does everybody have a barium swallow following the surgery to check for leaks and whether it was successful? No, you don't really need a swallow after the operation. This was a practice 10-15 years ago when surgeons had just, but most of us have done quite a few thousand operations. I've done over 1,000 sleeves and bypasses, and we hardly do a swallow after the operation to check. If, of course, I'm doing a very complex operation in patients who've had multiple previous operations, yes, in that case, I will do to make sure things are fine, but it is only for very complex revisional operations. But otherwise, usually we don't do a swallow. We have more questions coming in. Am I right? Is the sleeve suitable for type 2 diabetics? Emma, there are many things that we have to look at when we are deciding what operation you need to have. The sleeve is suitable for type 2 diabetics as well, along with the band, along with the bypass. It depends on how long you've had diabetes for, what medicines you're taking for your type 2 diabetes, and what other medical problems you have. It's a dynamic decision, which is why we advise that you need to come and see one of our surgeons or discuss with one of our surgeons on the phone or on the web, discuss what your problems are, and in that case, we will be able to advise you on what the right course of events is. Okay, question from LG. How many mini bypasses have you done? LG, thank you very much for that question. I've done quite a few mini bypasses. I do mini bypasses as a primary operation in patients who've had no previous surgery, but also I do a lot of mini bypasses as a revisional operation in patients who've had a previous band and that has failed, or in patients who've had a sleeve and they had a sleeve done abroad. Now, here is one of the interesting things I would like to tell you. I'm not saying that having surgery abroad is wrong, but you have to research your surgeon and go to the surgeon who's done thousands of operations, because we only get good once we've done a lot of operations. I have been recently referred a lot of patients who had sleeve only a couple of years ago abroad, and they have started gaining weight again. Now, in those cases, I've done a lot of mini bypasses, but at the same time, I would advise you that you have to come and discuss with the surgeon which is the best operation. One size doesn't fit all. We have to discuss with you what is the best option for you depending on your particular circumstances. Okay, we have more questions coming up. Let me check what's the next question. Question from Leanne. Okay. I've had a band. I've lost 6 stone and 2 pound, but I really just wanted to attend to say a huge thank you to him, but also to listen to advice on eating. Oh, well, that's very nice of you, Leanne. It is very nice of you to join this. Thank you very much for joining us. I hope you found it useful. We appreciate all your questions. If any of your questions have been unanswered, please email us at marketing@healthierweight.co.uk. I'll repeat the address again, marketing@healthierweight.co.uk. Thank you once again for joining us. And if you like this, please let us know and we'll do